I'm Dr. John Van Wagoner. I wanted to talk today a little bit about asthma. Asthma is a chronic inflammatory condition of the lung. And what that means is, typically for most patients that have asthma, they have chronic or long-standing inflammation that's going on in the large and small airways of your lungs. Not everybody has asthma. It's definitely not found in all people, but for most people that do have asthma, it is a chronic condition, and its hallmark is airway inflammation. Now that airway inflammation is unfortunately usually always present regardless of where the patient is or is not. And so it's not something you catch, it's not something you have today and then don't have tomorrow. Once you have asthma, for the majority of cases, you'll have it for a long period of time. Now granted, there are patients who definitely outgrow asthma as they get older. Usually asthma presents itself in the first decade of life, and so we'll have young children come in and there's concerns about asthma, and these patients may in fact go on to have asthma the rest of their life, but majority of patients that have asthma that presents in early childhood will have it during early childhood, and then they outgrow it typically in their teens and early 20s. Now what we've seen also is that some patients who have asthma early on, they may think they outgrow it in their early teens and in their 20s, but then it may come back and get them again, or at least they may have symptoms again back in their 30s and 40s. So it may be what we call biphasic. Now there are some adults that have new onset adult asthma. They never had asthma as a kid or an early adolescent, but then now they have asthma as a younger or older adult. Now that's another subset of patients that may in fact have asthma. Let's go back to what asthma is. I told you it's an inflammatory problem in the lungs. The hallmark of that is some changes in the airway epithelium or the airway lining that's very characteristic. There's recruitment and migration of lots of different inflammatory cells like eosinophils that come into the airway space and can be identified if you did a biopsy of the lung. The other thing that's also very characteristic of asthma is that there is what we call bronchoconstriction of the muscular area around the airway. So what that means is the airways are they can get very small because the airways around the muscles around the airway can constrict. And so some of those changes give us the symptoms that we see with asthma. So to summarize again, asthma is a chronic airway inflammation condition of the lungs. It's characterized inflammatory changes on the lining of the airways, but also we see some muscular involvement of the airway caliber around the airway that causes narrowing of the airway. What are some of the signs and symptoms of asthma? The most common sign and symptom of asthma would be cough. Some patients also may in fact have what we call wheezing. Shortness of breath is also common. Tight chest is a very common symptom. Those are the main features we see as symptoms or signs of asthma: is cough, shortness of breath, tight chest, difficulty getting air out as opposed to air in. Those are some common signs and symptoms. What are some common triggers of asthma? The number one trigger of asthma typically is a viral upper respiratory infection. So what you may call a cold that may be just normal for some patients to have would drop to the chest and also cause some chest involvement or an asthmatic response. So viral infections are a common trigger of asthma. Secondly, and very importantly as well, would be allergen exposure. Now that allergen exposure may be that you're allergic to a cat or a dog or some trees in the spring or weeds in the fall or mold exposure. Some of those exposures may in fact cause some allergic rhinitis symptoms in the nose like hay fever. For some people it has no effect whatsoever on their nasal health. In fact, it may just trigger breathing problems without even nasal symptoms. So it can be somewhat confusing because most people who think they have asthma, they think they may have allergies and asthma, but all they have is asthma issues and they don't think they have allergies. So allergies play another major role in asthma. There are other certain things that can trigger asthma: exposure to strong fumes and odors, changes in the weather, barometric pressure changes. Smoke is a big trigger. Those are some of the most common triggers of asthma. I want to talk about how asthma is diagnosed. Typically, there are a couple of things I look at when I'm trying to make a diagnosis of asthma in a child or an adult. The most important thing I focus on when I'm trying to make a diagnosis is the history. So I'll spend a lot of time on asking questions about certain signs and symptoms that you may in fact experience that may help me understand whether you have asthma or not. So I'll ask about what kind of symptoms do you have? Do you cough? Do you wheeze? Do you get short of breath? Do you get tight? I'll ask about what certain triggers are for you. Is it more pronounced when you exercise or in the middle of the night? Or when you're around certain fumes or odors or chemicals or around different allergens like a cat or a dog or around the horse. I'll ask about seasonality. Is it worse during the spring or the fall or the winter? I'll also ask how you have responded to different medicines you may have tried in the past from maybe your primary care doctor or another doctor. So most patients who have asthma, they'll respond very nicely to what we call inhalers. Now there are a lot of different inhalers that are out there that are used for asthma. The most important one would be what we call a rescue inhaler, or the other name of it is called albuterol. It's also there's different brand names that are available, but the name of the medicine that's the active ingredient is what we call albuterol. It's what we call a bronchodilator. It tends to relax the smooth muscles that surround the airway in someone who may in fact have asthma. And so the great thing about those drugs is they work very quickly and they can give relief within 15 to maybe sometimes even 5 minutes. And so if you tell me, yeah, I responded very nicely to that inhaler or that nebulizer that has albuterol in it, that kind of helps me understand that maybe you do in fact have asthma. The response to other types of medicines would also help me figure out whether you have asthma. If you've needed lots of steroids, either systemically or by mouth, or you've been given a shot of steroids or Decadron or Solumedrol, and your cough and your wheeze or your shortness of breath resolved pretty quickly within a day or so, that would also help me understand maybe whether you may in fact have asthma or not. So response to medications is sometimes very helpful in making a diagnosis of asthma. In addition, there's typically a family history of allergies or asthma in most patients that have asthma. It tends to be a genetic inherited disease. So usually if one patient has asthma, there's other family members that may in fact also have asthma or allergies or eczema. So it runs in families. The response to exercise is a unique one. There are a lot of people that have asthma, and the majority of them have exercise-induced asthma. And so that tends to be a kind of a particular question I'll ask is, do you have trouble when you exercise? Now, here's the deal. Most patients that have asthma also have exercise as a trigger of their asthma. But there is a small subset of patients that have asthma, but exercise does not trigger their asthma. So you can get caught on that sometimes, and so not everything that looks like a duck is a duck. So that's just one little caveat explanation about asthma. In addition to the history and your response to medications, we sometimes use what we call pulmonary function testing. It's a test that we have available in our office. It's very easy, takes about a minute to do, and it's a way that I can monitor or at least measure your airway dynamics. And what I'm measuring is just how much air you blow out over time. The test is easily done. Typically I can teach a 5-year-old or anybody above that to be able to do the maneuvers that are necessary to do this, what we call pulmonary function test. And it's a computer-generated result test that is effort dependent, and technique is important, and so the nurses and I will work with the patient to allow them to be able to do the test appropriately and accurately so we can rely on the results. And then we can kind of see with regards to your pulmonary function testing whether you also may in fact have asthma. Now what are we looking for in a pulmonary function test? Like I said, we're measuring how much air you blow out over time. For some people that have asthma that's been not treated properly, your lung function may be very low compared to people that don't have asthma. And so when we do the lung function test, you may have values that are very below normal. Now in that situation, I would give you some medicine called albuterol, or what we call a bronchodilator, that works very quickly in the office. And then we'd wait 15-20 minutes and then have you blow one more time in the computer. And then typically what we see in patients that have asthma is that your lung function would go from bad or low to better or improved. And so That change is called a delta, is suggestive of asthma. Not all people that have asthma have that change after a bronchodilator, but in some situations, especially patients that have not been diagnosed accurately, you may see a large change, and that may be reflective or suggestive of asthma. There's other tests that are available to look to see whether someone has asthma. They're not all commercially available and they're not all used in all offices. There's really no blood test that's available to look to see whether one has asthma. Really the most important thing when it comes to me making a diagnosis of one having asthma or not is really the history and your response to medicines and whether there's a family history of asthma, allergies, or other allergic conditions. Plus we'll use the skin testing methods to look to see whether you have allergy, and also lung function testing to help us understand your airway dynamics. In all, it's a very difficult diagnosis sometimes. It takes an expert who knows kind of the ins and outs of what asthma is and how these medicines work in order to give you a firm diagnosis. Thank you for listening.